Part A. Extract 1. Questions 1 to 12. You hear a dietitian talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. Please, have a seat. What brings you in today?
Hi, Mr. Ray. Thank you. I'm a bit concerned about my baby Anya. She's 8 months old now, and I've been trying to introduce her to solid foods, including eggs. But every time I give her something with an egg, she seems to have a reaction.
I understand. Can you tell me a little more about these reactions? What kind of symptoms does she experience?
Well, it varies a little. Sometimes she gets a bit fussy and develops a slight rash around her mouth.
Okay.
Other times, she has some watery stools and seems uncomfortable. It usually resolves within a few hours, but it worries me.
Right. Now, does anyone in your family, or Anya's father's family, have any allergies or sensitivities, particularly to eggs?
Let me think. My brother has hay fever, but I don't know of any specific egg allergies. Although, now that you mention it, my sister-in-law did mention being a bit lactose intolerant. Could that be related?
It's unlikely, but it's good to note. Now, how have you been trying to introduce the eggs? Have you tried different forms, like scrambled eggs, or mixed in with other foods?
Yes, I've tried both. Initially, I started with a little bit of scrambled egg yolk, but she didn't take to it very well. Then I tried mixing some mashed banana with a bit of cooked egg white, hoping she wouldn't notice. Unfortunately, that's when she seemed to have the worst reaction with the rash.
I see. Based on the symptoms and your family history, there is a possibility Anya could have an egg allergy.
Oh no.
Mihira, to confirm this, we might need to perform an oral food challenge here in the clinic under controlled supervision.
Oh, that sounds a bit scary.
Don't worry, it's a very safe procedure. We'll gradually introduce small amounts of egg in different forms to see how she reacts. Now, assuming it is an allergy, the best remedy is to completely eliminate eggs from her diet. However, eggs are a good source of protein and essential nutrients. We can discuss alternative options to ensure she gets a balanced diet.
That's a relief. I wouldn't want her to miss out on any important nutrients. What kind of alternatives can we consider?
Excellent question. There are several options, Mihira. We can focus on other protein sources like lean meats, fish, beans, and lentils. Additionally, fortified cereals and milk can provide some of the vitamins and minerals found in eggs.
That's helpful. I would feel much more comfortable knowing how to manage this and keep her balanced.
Absolutely. We can discuss specific dietary modifications and create a plan that works best for Anya. Would you like to schedule a follow-up appointment to discuss this further after we have the results of the diagnostic test?
Yes, please. Thank you so much, Mr. Ray. I feel a lot better equipped to handle this now.
Extract 2. Questions 13 to 24. You hear a psychiatrist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. Please come in and have a seat.
Thank you.
So, Mihira, I understand from your referral that you've been experiencing a lot of stress lately. Can you tell me a little bit more about what's been going on?
Well, it's been building for a while, I think. Probably started a few months ago when I started my final year of university. The workload suddenly became really intense, and the pressure to get good grades to get into grad school is just exacerbating my anxiety.
I understand. The final year of university can be a very stressful time. Can you describe some specific situations that have been particularly challenging for you?
Sure. Like last week, I had 3 major deadlines all due within 2 days. I pulled an all-nighter trying to finish an essay, and by the morning I felt like my brain was fried. I ended up getting a panic attack during my statistics exam, and I completely blanked on everything I knew. It was humiliating.
That sounds very difficult, Mihira. Panic attacks can be quite debilitating. Have you tried anything to manage your stress so far?
I make an effort to maintain a regular exercise routine, but amidst all the studying, finding the time becomes challenging. I also try to eat healthy, but sometimes I just resort to grabbing fast food because it's convenient. I know it's not good for me, but when I'm stressed, I just don't have the energy to cook.
It's understandable. It sounds like you're already making some efforts to manage your stress. That's a good first step. I want to assure you that stress is a very common experience, especially among students. It's important to remember that you're not alone in this. Now, let's talk about some specific strategies you can use to manage your stress more effectively. One key approach is to develop healthy coping mechanisms. These are tools you can use to deal with stressful situations in a way that's healthy for your mind and body.
Like what?
There are many different options. Relaxation techniques like deep breathing exercises and progressive muscle relaxation can be very helpful. They can help calm your nervous system and bring your body back to a state of rest.
I've heard of those. I might try deep breathing next time I feel overwhelmed.
Excellent. Another important stress management technique is time management. Having a well-organized schedule and setting realistic goals for yourself can help you feel more in control and reduce feelings of being overwhelmed.
That's a good point. Sometimes I feel like I have so much to do that I don't even know where to start.
That's normal. Having a schedule can help you prioritize tasks and ensure you allocate enough time for each one. It can also help you schedule some time for relaxation and self-care, which is crucial during stressful times.
Self-care, huh? I do neglect that sometimes.
Yes, taking care of yourself physically and mentally is essential for managing stress. This can include getting enough sleep, eating healthy foods, and engaging in activities you enjoy. These activities don't have to be time-consuming. Even just 15 minutes of reading or listening to music can make a big difference.
You're right. Maybe I should start incorporating some of those things into my routine.
Absolutely. We can also explore additional resources that might be helpful for you. For example, your university might offer stress management workshops or counseling services.
Oh, I didn't know that. I'll definitely look into it.
Great. There are also many online resources available that can provide you with information and tools for managing stress.
Thanks for letting me know. I feel a bit more hopeful already.
That's fantastic, Mihira. I'm glad. Now, it's crucial that we formulate a strategy to assist you in effectively managing your stress over the long term.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a GP called Mihira talking to a community nurse. Now read the question.
Good morning, David. Thanks for the follow-up call regarding Mrs. Eleanor Ainsworth. I recall she presented last week with complaints of fatigue and some mild dizziness. We ran a few blood tests, mainly looking at her iron levels and thyroid function, given her history of borderline anemia a couple of years ago. The initial results for those came back within the normal range, which was somewhat unexpected. She also mentioned experiencing occasional palpitations, which we initially attributed to anxiety given her recent bereavement. However, she did mention that the fatigue seems to be worsening, and she's now reporting some intermittent tingling in her fingers and toes, which is a new symptom since our last consultation.
Yes, Dr. Mihira. I visited Mrs. Ainsworth this morning as scheduled. She seems a little more withdrawn today. She reiterated the increasing fatigue and the tingling sensation, which she says comes and goes. She also mentioned feeling quite breathless after minimal exertion, something she didn't report last week. She's been meticulously documenting her symptoms as you advised. She did mention her appetite has decreased slightly too, but she attributed that to her low mood.
Right, the new symptom of breathlessness is concerning, especially coupled with the tingling. It shifts the picture somewhat. While the initial blood work ruled out straightforward anemia or thyroid issues, these new developments suggest we need to consider other possibilities. The breathlessness, in particular, warrants further investigation. Let's schedule her for an ECG and perhaps a more comprehensive blood panel to explore potential cardiac or neurological involvement. Please inform her of this and reassure her that we're taking her concerns seriously.
Now look at question 26. You hear a nurse called Mihira talking to a nursing manager. Now read the question.
Hi, Samuel. Do you have a moment? I wanted to discuss the upcoming shift schedule. I noticed a few inconsistencies that might impact patient care continuity. For instance, there seems to be a pattern of short staffing on several night shifts next week, which could lead to increased workload and potential burnout for those on duty. Also, I observed that there are 2 consecutive days where a relatively new staff member is scheduled to handle complex wound dressings without a senior colleague present, which might not be the best support for them or the patients. Furthermore, my request for a slight adjustment to my roster on the 18th, due to a prior family commitment I mentioned a while ago, doesn't seem to have been reflected. It's just that arranging childcare for that specific evening is quite difficult.
Thanks for bringing this to my attention, Mihira. I appreciate you being so proactive. Regarding the night shift staffing, that's due to a couple of unexpected sick leaves we're trying to cover with agency staff, but I agree it's not ideal. On the matter of the new staff member and complex dressings, I'll certainly review that and ensure a senior nurse is paired with them. Now, about your roster adjustment for the 18th. Let me pull up the schedule here. Ah, I see your initial request. There was a bit of confusion with the leave request that week, as several staff members had similar date clashes for various reasons. Let me see if I can still make that adjustment for you, given it was a prior commitment.
Thank you, Samuel. I understand the staffing challenges. My main concern with the 18th was just ensuring adequate handover for my patients, knowing it was a previously agreed upon arrangement.
Now look at question 27. You hear an ENT called Mihira talking to a school health nurse. Now read the question.
Hello, Carol. Thanks for calling about young Thomas Ashton. I reviewed your notes regarding his recent referrals. You mentioned he's been complaining of intermittent earaches, particularly his left ear, and some associated muffled hearing. You also noted a couple of instances of him pulling at his ear during class, which initially suggested a possible foreign body or perhaps early signs of otitis media, given his age. However, you also mentioned a recent history of nasal congestion and a mild sore throat that resolved spontaneously. He hasn't had any fever or discharge, which makes a straightforward infection less likely. He did mention some sensitivity to loud noises recently, which is a bit unusual given the other symptoms.
Yes, Dr. Mihira. That's a good summary. The inconsistent nature of his complaints is what made it a bit puzzling. The earaches aren't constant, and the hearing seems to fluctuate. The pulling at his ear has also become less frequent in the last couple of days. He mentioned the noise sensitivity only yesterday, saying the school bell sometimes feels too loud. His parents haven't reported any significant issues at home, just the occasional complaint about his ear feeling blocked.
Right, the fluctuating symptoms and the new report of noise sensitivity, alongside the recent nasal congestion, make me lean away from a simple infection or foreign body. It could be related to eustachian tube dysfunction, perhaps triggered by the recent mild upper respiratory tract infection. The sensation of a blocked ear and the noise sensitivity can both be indicative of pressure changes in the middle ear. Let's advise observation for now, focusing on managing any nasal congestion if it recurs. If the symptoms persist or worsen, especially the hearing loss or noise sensitivity, we can schedule him for a tympanometry to assess middle ear function.
Now look at question 28. You hear a doctor called Mihira talking to a patient. Now read the question.
Good afternoon, Mr. Harrison. Thanks for coming in today. You mentioned experiencing some persistent headaches, primarily at the back of your head, and some associated neck stiffness. You also noted feeling quite fatigued lately, which you initially attributed to stress at work. We discussed your history of occasional migraines, and you were concerned these new headaches might be a recurrence. However, you also mentioned some intermittent blurred vision, particularly when you stand up quickly, which wasn't a typical feature of your previous migraines. You've been monitoring your blood pressure at home, and the readings have been slightly elevated compared to your usual.
Yes, Dr. Mihira. The headaches are quite bothersome, and the neck stiffness makes it difficult to concentrate. The fatigue is also quite draining. I was worried it was just my old migraines acting up, but the blurry vision is new, and it's quite unsettling. It only lasts for a few seconds, but it happens several times a day. And yes, my home blood pressure readings have been a bit higher than usual this past week. I haven't changed my diet or exercise routine significantly.
Right, the combination of persistent posterior headaches, neck stiffness, new onset of postural blurred vision, and slightly elevated blood pressure reading suggests we need to consider a different underlying mechanism than just a typical migraine recurrence. While migraines can sometimes present with neck pain, the postural visual disturbance and the blood pressure findings point towards a possible link involving your circulatory system. The fatigue could also be related to this. Therefore, I'd like to do a more thorough blood pressure check here in the clinic and perhaps order some further investigations, including a more detailed neurological assessment, just to rule out any other contributing factors.
Now look at question 29. You hear an occupational therapist called Mihira talking to a doctor. Now read the question.
Hi, Dr. Williams. I'm calling about Mr. George Davies. I've been working with him on his rehabilitation following his fall. He's made good progress with his gross motor skills, and his balance has improved significantly. However, he's still experiencing considerable difficulty with fine motor tasks, particularly anything involving dexterity in his right hand. He initially attributed it to general weakness post-injury, and we've been focusing on strengthening exercises. However, he mentioned today that he's also noticed a persistent tingling sensation in his right thumb and index finger, which seems to be exacerbated by repetitive movements. This tingling wasn't present in our initial assessments. He also mentioned some mild neck pain radiating down his right arm occasionally, which he thought was just muscular strain from the fall.
Thanks for the update, Mihira. The new symptom of tingling, especially with repetitive movements, and the radiating neck pain are important to note. While the initial weakness post-fall could explain some of the fine motor difficulties, this new sensory symptom, coupled with the neck pain, suggests a possible nerve involvement. The repetitive tasks and therapy might aggravate an underlying issue. The initial fall might have caused more than just musculoskeletal injuries. We need to consider if there's any nerve compression or irritation contributing to his current functional limitations.
That was my concern too, doctor. The pattern of tingling and its exacerbation with specific movements, along with the neck pain, makes me suspect something beyond just deconditioning from the fall.
Now look at question 30. You hear a nursing manager called Mihira talking to a doctor. Now read the question.
Hi, Dr. Sharma. I wanted to discuss Mrs. Evelyn Reed on Ward 3. She's been reporting increasing levels of pain post-operatively following her hip replacement. Initially, her pain was well controlled with the prescribed analgesia, and she was mobilizing as expected. However, over the last 24 hours, she's needed significantly more pain relief, and she's less willing to move. She also mentioned feeling quite nauseous this morning, which she initially thought was a side effect of the stronger pain medication we administered. However, she also reported some unusual swelling around the surgical site, which wasn't evident during my earlier rounds. This new swelling is what's particularly concerning me, given the change in her pain levels and reduced mobility.
Thanks for the update, Mihira. The increased pain despite analgesia and the reduced mobility are certainly concerning. While nausea can be a side effect of opioids, the new onset of swelling around the surgical site is a significant finding. It suggests a potential issue beyond just expected post-operative discomfort or medication side effects. The swelling could indicate a developing hematoma or even a possible infection, both of which would explain the escalating pain and reluctance to move. We need to assess her surgical site promptly. The nausea could also be related to systemic inflammation if there's an underlying issue at the surgical site.
Exactly my thoughts, doctor. The localized swelling in conjunction with the disproportionate increase in pain is what prompted me to call.
Part C. Extract 1. Questions 31 to 36. You hear the conversation between a pulmonologist Mihira and an interviewer. You now have 90 seconds to read questions 31 to 36.
Welcome, Dr. Mihira. Thank you for taking the time to speak with us today about the critical intersection of work hazards and respiratory health. To begin, could you paint us a picture of the current landscape of health issues arising from workplace hazards? What is the prevailing situation we are observing in pulmonology?
Thank you for having me. The current situation is quite concerning, although there's a growing, albeit slow, recognition of the significant impact workplace hazards have on respiratory health. We are seeing a steady influx of patients presenting with conditions directly or indirectly linked to their occupational exposures. These aren't just the traditionally recognized ailments, like asbestosis or silicosis from heavy industries. We're also observing a rise in more insidious conditions, exacerbations of asthma, due to exposure to irritants in office environments, hypersensitivity pneumonitis from organic dust in agricultural or even some manufacturing settings, and a general increase in chronic obstructive pulmonary disease, COPD, potentially aggravated by long-term exposure to lower levels of airborne pollutants in various workplaces. Furthermore, the psychological stress associated with hazardous work environments can also manifest in respiratory symptoms or worsen pre-existing conditions. So while awareness is increasing, the actual burden of work-related respiratory illnesses remains substantial and perhaps even underreported in many sectors.
That paints a sobering picture. Delving deeper into the challenges, what would you say are the most significant and complex aspects that employees face when dealing with work-related health hazards? It's perhaps more than just the direct physiological impact, isn't it, Dr. Mihira?
Absolutely. The challenges are multifaceted. Beyond the direct physiological damage, employees often grapple with a complex web of issues. Firstly, there's the difficulty in establishing a clear causal link between their workplace exposure and their respiratory illness, especially when symptoms develop gradually over the years or when multiple exposures are involved. This can lead to delays in diagnosis and appropriate treatment, and also complicate compensation claims. Secondly, there's often a power imbalance. Employees may fear reprisal for raising concerns about workplace safety or reporting health issues, leading to underreporting and a reluctance to seek help. Thirdly, the psychological toll of working in a hazardous environment cannot be understated. Constant anxiety about potential exposure, the stress of managing chronic illness while trying to maintain employment, and the emotional burden of reduced quality of life all contribute significantly. Finally, access to specialized healthcare and occupational health services can be a major barrier, particularly for workers in smaller enterprises or those in geographically remote areas. These intertwined factors make addressing work-related health hazards a deeply challenging endeavor for affected individuals.
That highlights the systemic nature of the problem. On the other side of the equation, how conscious would you say employers generally are regarding these work hazards and their responsibility towards employee health, particularly concerning respiratory well-being? Is there a proactive approach, Dr. Mihira, or is it often reactive?
Employer consciousness varies significantly across industries and even within the same sector. While larger corporations often have dedicated health and safety departments and adhere to regulatory standards, the level of awareness and proactive engagement can be less robust in small and medium-sized enterprises, SMEs. There's often a spectrum, ranging from organizations that genuinely prioritize employee well-being and implement comprehensive preventive measures to those that primarily focus on compliance with minimum legal requirements, reacting only when incidents occur or when mandated by law. Economic pressures can sometimes lead to a prioritization of productivity over safety investments. However, we are seeing a gradual shift in some sectors, driven by increasing awareness of the long-term costs associated with work-related illnesses, including lost productivity, compensation claims, and reputational damage. There's also a growing recognition that a healthy workforce is a more productive and engaged workforce. So while progress is being made, a truly proactive and universally applied approach to mitigating respiratory work hazards is still some way off.
Given this landscape, Dr. Mihira, what role does a pulmonology department typically play in addressing these health issues arising from work hazards? Are there specific initiatives or protocols in place within your department, for instance?
Our pulmonology department plays a crucial role, often acting as a point of diagnosis and management for individuals suffering from work-related respiratory illnesses. While we may not directly conduct workplace safety audits, we are increasingly involved in raising awareness and collaborating with occupational health physicians and other specialists. For instance, we have established a dedicated clinic that specializes in evaluating patients with suspected occupational lung diseases. This allows us to develop expertise in recognizing patterns of illness linked to specific exposures and to provide tailored diagnostic and treatment plans. We also participate in multidisciplinary team meetings with occupational therapists, physiotherapists, and occupational health nurses to provide holistic care. Furthermore, we are actively involved in educating our medical trainees about the importance of taking a thorough occupational history and considering work-related exposures in their differential diagnoses. We believe that early identification and appropriate management are key to improving outcomes for these patients.
Expanding on that, how does a pulmonology department typically go about evaluating the overall well-being of workers who may be exposed to respiratory hazards? It's more than just lung function tests, I imagine, Dr. Mihira.
You are absolutely right. Evaluating a worker's well-being in this context requires a comprehensive approach that goes beyond standard pulmonary function tests. While spirometry, lung volume measurements, and diffusion capacity tests are essential for assessing lung function impairment, they are only one piece of the puzzle. Our evaluation process typically involves a detailed occupational history, meticulously documenting the types and duration of exposures, the work environment, and any safety measures in place. We also look for patterns of symptoms that might correlate with specific workplace exposures. Imaging techniques like chest X-rays and CT scans are crucial for identifying structural lung changes. Furthermore, we consider the impact of the respiratory condition on the individual's quality of life, their ability to perform daily activities, and their mental well-being. We may use questionnaires and assess exercise tolerance. In some cases, more specialized investigations like bronchoscopy with bronchoalveolar lavage or lung biopsies might be necessary to identify the specific cause of the lung disease. So, it's a holistic assessment that integrates clinical findings, occupational history, and functional impact to understand the true extent of the work-related illness on the individual's overall well-being.
Looking towards the future, what are some of the key plans or aspirations of the pulmonology department in further addressing and improving the well-being of workers exposed to respiratory hazards? What are the next steps in this crucial area, Dr. Mihira?
Our future plans are focused on several key areas. Firstly, we aim to strengthen our collaborative efforts with occupational health professionals, employers, and regulatory bodies to promote primary prevention strategies. This includes advocating for stricter workplace safety standards, improved ventilation systems, and the use of personal protective equipment. Secondly, we plan to expand our research efforts to better understand the long-term health consequences of various occupational exposures and to develop more effective diagnostic and treatment modalities. This includes exploring the role of biomarkers and advanced imaging techniques. Thirdly, we want to enhance our educational outreach to both healthcare professionals and workers themselves, raising awareness about the risks and the importance of early detection and intervention. We envision developing accessible resources and conducting workshops on respiratory health and workplace safety. Finally, we are exploring the potential of telemedicine and remote monitoring to improve access to specialized pulmonology care for workers in underserved areas. Ultimately, our goal is to create a healthier working environment and to ensure that individuals affected by work-related respiratory illnesses receive timely, comprehensive, and compassionate care.
Extract 2. Questions 37 to 42. You hear a presentation by physiotherapist Justin Hayfield about the modernization of rehabilitation at Mihira Care. You now have 90 seconds to read questions 37 to 42.
Good afternoon, esteemed colleagues and guests. It is a privilege to stand before you today at the Mihira Healthcare Institute to discuss a matter of growing concern that demands our attention: the potential health hazards associated with the pervasive use of earphones and headphones. My name is Justin Hayfield, and as an ENT specialist at Mihira Care, I have been deeply involved in recent research endeavors here at Mihira Healthcare Institute, investigating the ramifications of this ubiquitous technology on our auditory and overall well-being. Our investigations at Mihira Care have revealed a situation that warrants serious consideration. While earphones and headphones offer convenience and immersion in a personal audio sphere, their widespread and often excessive use presents an alarming trend with potentially significant public health implications. The sheer volume of individuals, particularly younger demographics, who habitually use these devices for extended periods and at elevated sound levels suggests a looming crisis in auditory health if left unaddressed. The data we have compiled at Mihira Healthcare Institute indicates a noticeable increase in reported cases of noise-induced hearing loss and related otological issues among regular headphone users compared to control groups. This is not merely a minor inconvenience, it is a potential harbinger of a future where a significant portion of the population may experience preventable hearing impairment, impacting their quality of life, communication abilities, and overall well-being. The accessibility and affordability of these devices, coupled with their integration into various aspects of daily life, from entertainment to communication, exacerbate the potential for widespread harm. Therefore, based on our findings at Mihira Care, the situation is indeed alarming and necessitates proactive measures. The consequences of prolonged and unsafe headphone use extend beyond just hearing loss. Our research at Mihira Healthcare Institute has illuminated a spectrum of potential health issues. Tinnitus, a persistent ringing or buzzing in the ears, is a frequently reported consequence, often preceding or accompanying hearing impairment. This phantom auditory perception can significantly impact concentration, sleep, and mental well-being. Furthermore, exposure to high decibel levels through earphones can contribute to hyperacusis, an increased sensitivity to everyday sounds, making normal auditory experiences uncomfortable or even painful. Beyond the direct auditory effects, our studies at Mihira Care suggest a potential link between prolonged headphone use and an increased risk of ear infections, particularly with in-ear models that can create a warm, moist environment conducive to bacterial and fungal growth. Some individuals have also reported experiencing headaches, dizziness, and even nausea, possibly due to the sustained pressure exerted by certain headphone types or the intense auditory stimulation. The psychological impact, including increased stress and social isolation due to constant immersion in personal audio, is another area we are actively exploring at Mihira Healthcare Institute. These consequences, both auditory and non-auditory, underscore the multifaceted nature of the health hazards associated with irresponsible headphone usage. The primary cause for these detrimental effects lies in the direct exposure of the inner ear to sound waves generated by earphones and headphones. Unlike ambient sounds that dissipate and interact with the environment, these devices deliver sound directly into the ear canal, often bypassing the natural protective mechanisms of the outer ear. The intensity and duration of this direct sound exposure are the critical factors. Sound intensity is measured in decibels, dB, and prolonged exposure to levels above 85 dB can cause irreversible damage to the delicate hair cells within the cochlea, the sensory organ responsible for hearing. Many earphones and headphones, particularly at maximum volume, can easily exceed this threshold. Furthermore, the duration of exposure plays a crucial role. Even at moderately loud volumes, prolonged continuous use can lead to cumulative damage over time. The proximity of the sound source to the eardrum in in-ear monitors further intensifies the potential for harm compared to over-ear headphones, although both types can pose risks if used improperly. The lack of awareness among users regarding safe listening levels and durations, coupled with the tendency to increase volume to mask ambient noise, significantly contributes to the problem. Our research at Mihira Care emphasizes that this direct and often unregulated sound transmission is the fundamental mechanism driving the observed health hazards. Preventive measures are crucial in mitigating the risks associated with earphone and headphone use. Education and awareness campaigns, such as those we are planning at Mihira Healthcare Institute, are paramount in informing the public about safe listening practices. This includes emphasizing the 60-60 rule, listening at no more than 60% of the device's maximum volume for no more than 60 minutes at a time, followed by a break. Encouraging the use of noise-canceling headphones can also be beneficial, as they reduce the need to increase volume to overcome external sounds. Regular hearing checks, especially for frequent headphone users, are essential for early detection of any hearing loss. Promoting responsible usage habits from a young age through school-based programs and parental guidance is also vital. Furthermore, manufacturers have a role to play in designing devices with built-in volume limiters and providing clear warnings about potential risks. At Mihira Care, we advocate for greater emphasis on user responsibility and informed choices regarding headphone usage. Implementing these preventive measures requires a multi-pronged approach. Public health organizations and healthcare institutions like Mihira Healthcare Institute can spearhead awareness campaigns through various media channels, including social media, websites, and community outreach programs. Integrating educational modules on safe listening practices into school curricula can reach younger audiences effectively. Healthcare professionals, particularly primary care physicians and ENT specialists at Mihira Care, should routinely counsel patients about the risks of excessive headphone use and recommend regular hearing screenings. Collaboration with technology manufacturers is essential to promote the development and adoption of safety features in audio devices. Clear and prominent labeling on product packaging regarding potential risks and safe usage guidelines is also necessary. Furthermore, creating accessible resources and support for individuals experiencing hearing problems related to headphone use is crucial. At Mihira Healthcare Institute, we are developing protocols for identifying and managing such cases effectively. Looking towards the future, the landscape of personal audio technology is likely to continue evolving. Wireless earbuds and bone conduction headphones are becoming increasingly popular, each with its own set of potential benefits and risks that require ongoing research, such as that being conducted at Mihira Healthcare Institute. The integration of artificial intelligence into audio devices could potentially offer real-time feedback on listening levels and durations, promoting safer usage habits. However, the challenge lies in ensuring that these advancements prioritize user health and safety alongside convenience and functionality. Without proactive measures and continued research, we risk a future where noise-induced hearing loss becomes even more prevalent, placing a significant burden on healthcare systems and impacting the quality of life for millions. Therefore, continued education, responsible technological development, and ongoing research at institutions like Mihira Healthcare Institute are crucial to shaping a future where individuals can enjoy the benefits of personal audio without jeopardizing their hearing health. Our commitment at Mihira Care remains steadfast in addressing this evolving challenge.